Welcome back to Midday Kentucky, everyone. Of course, sitting beside me, the renowned Dr. Henry Wells from Wells Plastic Surgery and Skincare. And today's topic is something that you are well known for in this state of Kentucky, and it's called the Mommy Makeover. And it's basically talking about a surgery that's post-pregnancy. Am I correct?
Exactly. Yeah.
Good. We're going to bring up on the screen now of the procedures of what is involved in a mummy makeover. So let's go through them. We've got the breast lift, the breast augmentation, the breast reduction, tummy tuck, and also can include liposuction. Exactly. Here's my question to you. Is a mummy makeover meaning you have to have all of those?
Not necessarily.
Okay, talk me through that.
But we have a lot of different options for the patient so that we can tailor the procedure to their specific needs. Typically, the tummy tuck is pretty much the same for everyone.
Right.
I mean, the muscles of the abdomen weaken after pregnancy. There's loose skin and stretch marks, and the tummy tuck will address all of those things. The breast surgery, a little bit different because some women have just atrophy of their breasts. Some women get large breasts during pregnancy and they have sagging and atrophy. And some women get large breasts and they stay large even after the pregnancy.
Right.
So we offer breast lift and augmentation, and breast reduction as part of the Mommy Makeover process.
Okay, I'm going to throw you a curveball here. It wasn't on my list of questions. Should you really have that decision of not wanting to have any more children after your mummy makeover?
Oh yes.
Okay.
If you have a mommy makeover and you have all these procedures done and you become pregnant again, you could easily start back where go back to where you started and have sagging breasts and a loose tummy and so forth.
Okay.
You can have children, but I don't recommend it.
All right, we're going to bring up some more reasons why a woman should consider having a mummy makeover as well. Here they are now, as we already talked on a little bit them to begin with. Sagging breasts, enlarged breasts, excess abdominal skin and loose stomach muscles.
Yeah.
How do you go back in with the tummy tuck? I want to touch on that a little bit more. With the tummy tuck, what are you actually doing with the tummy tuck?
Well, with pregnancy, the uterus expands and those muscles stretch, and actually a space develops between the rectus muscles in the abdomen. And so we not only reduce the amount of loose skin that you have, but we also tighten those abdominal muscles. Once we tighten the muscles, we pull the skin down, take out the excess, and bring the belly button out through a new opening in the skin. Okay.
Pros and cons of having a mummy makeover, they're up on the screen now as well. Flat, youthful tummy, well, that's a bonus. A firmer, well-shaped breast, clothes and swimwear, of course, fit better. You will look trimmer and younger, restores your appearance and your confidence. Now, they're all the pros. They're amazing.
Well, the thing is, what you're talking about is how the patient perceives themselves. After pregnancy, all of these things happen that cause the breast to get sag and cause the abdomen to get weak and loose. And it affects their perception of themselves, their self-esteem, and it affects their relationships with others. And they feel that they would look better and feel better about themselves if they had these things addressed.
I was telling a friend of mine that you were coming on, and she's had children. And she asked me, she said, ask Dr. Wells, how long after she has her baby can she have a mummy makeover?
Well, there are two things. Number one, how long do you have to wait after you have the baby? And we say at least 6 months.
Really?
But the other thing is nursing. You have to wait at least 3 months after you stop nursing before you can have surgical procedure on your breast.
I didn't know that. Interesting. Okay, what other issues should be addressed, Dr. Wells? Is there anything that we haven't covered?
Well, obviously, you need to know what the potential complications are. You need to know what your downtime is going to be, what your recovery is going to be like. And you need to understand the specifics of the procedure, what they're going to be doing. And most importantly, you need to understand what your outcome is going to be like. Is that going to address your concerns? And I really think it's important for your surgeon to explain to you what your expected outcome would be like, show you pictures and so forth, to make sure that you will get the result that you're looking for.
And I think that's the most important thing, because you have some incredible before and afters on your website from Mommy Makeovers, and you have to be ready. Do it for yourself.
Exactly.
Not for anyone else, because
Exactly.
they're your expectations and your desires.
Right.
Dr. Wells, as always, great information. We appreciate you. If you want to find out more information about Wells Plastic Surgery and Skincare, there it all is there, everyone. There's the phone number and the website. Hey guys, have a great time. We appreciate you coming in again. Back after this short break.